When you talk about prescribing medicine, the number one point that you want to drive home is safety, safe practices. And in order to safely approach prescribing medication, there's a certain knowledge base that you should have.
We often find that when we look further into things medically, that medical illness can masquerade as psychiatric illness, and that in fact we really can't separate the two. We can't say somebody has a head and then not treat the rest of the body. So I think that's where physicians who are medically trained really are important in terms of being able to prescribe safely.
No matter what area of medicine you're talking about, there's always going to be an issue of access. And if you look at where psychologists and psychiatrists are in Illinois, there's no difference in terms of the region. I think the argument that's been proposed is that this will allow patients that are in areas where they can't have access to services have a greater access to services, when really the numbers of psychiatrists and psychologists in these underserved areas is the same.
We just need to pass laws that make the integration and incentive for primary care better, to increase mental health services and to consult with psychiatrists, rather than passing laws that allow unqualified people to prescribe.